In line with other physiotherapists and general medical practitioners, in the COVID-19 pandemic, we're operating a system called Virtual First. And what that means is that we will give you your initial consultation either via Zoom or on the telephone. So when you phone up for an appointment, you'll be offered your normal appointment, and then we will send you an email with a Zoom link. And this is just a quick video to talk you through what will happen. So here we've got my email, and you'll notice that it has a blue area on it. Sometimes that blue area doesn't show up until you put your mouse pointer over it or until you place the spacebar. But once it shows up, you'll see that the arrow, when I hover over it, changes to a finger, and when it changes to a finger, I can follow that link, and that will take me to the Zoom program. So you don't need to have Zoom on your computer, you can use it without having that. That said, of course, if you are already familiar with Zoom and you have it on your computer, then you don't really need to watch the rest of the video, because all you would do is type in the meeting ID and the password, and that will take you straight through. But assuming that you're not familiar with Zoom, you hover over this, and if the little finger doesn't show up, just press the control bar on your computer, and then when you click that, that will then take you to Zoom. So it will open up with the full screen to start with, and then it will connect with this little mini screen. Now, a couple of things about this. Firstly, you need to make sure that you take your mouse over this small square. So my mouse at the moment is in this larger part of the screen, and it's not until I take it to the small part that I get this black bar appearing over the bottom of the small square. Now that's important because on the far left you can see that there's a picture of the microphone, and there's a sort of a vertical temperature gauge which is going up and down green, and that shows me that my audio is working. So that's the first check that we would do. The second thing is, by default, it starts with your video off. So you can see that this video has a red line through it, and that's sort of for privacy really, but you need to click that so that the video is on, and then you can see yourself in the mirror, as it were. So I can see myself here. And then on the bottom line, what I will see is participants, and when I click that, it will come up with the names of the participants. So my name first, and John Smith or whoever is the next person on, and I would then click that to bring you into the Zoom meeting, and then once we're there we can chat. Now, just another quick check really here, that even when that black bar has gone, on your name you should be able to see the microphone moving. So there's no red line across the microphone here, and there's no red line across the video. So that will mean that everything is recording correctly. So in terms of setting things up, if you're familiar with this system, then just to reiterate a couple of points really, you need to be in a sort of a quiet room without distractions. So dogs, cats and children out of the way preferably. If you're not familiar with it, then by all means have somebody else there with you operating all the sort of knobs and dials. Now, we won't record the screen. When you go down to the bottom of this screen, there's an option here that you can click on that says record on the computer. Now, we don't do that routinely unless you want us to. So if we're demonstrating some exercises or something for you and you would prefer to have a record of that, then we can record the screen. So that's it really. Make sure that you're sort of arriving for the meeting 5 minutes beforehand, just to check everything, and then phones are off, TV is off, this type of thing. So it will take us about 20 to 30 minutes for the interview, and it really is exactly the same as if you were coming to the clinic. So we'll hear about your condition and your sort of story, and the various bits and pieces that you've gone through, and we'll ask you some questions, get you to do some some movement. So, if it's an upper limb condition, then just use a sort of a strappy top, as it were. And if it's a lower limb or a back, then just wear a pair of shorts, because we will ask you to do some movements. We may ask you to do some different exercises and bits and pieces, but you don't need anything special for the meeting. So the first one is really a consultation, and from that we will give you some advice and sort of say what to do. And if necessary, we will then say, well, okay, I think it's better that you come into the clinic, and we will then talk you through that procedure. Okay, so that's our virtual physiotherapy appointment, sometimes called a remote appointment and sometimes called IntelliHealth, exactly the same thing. So when you receive that email from us, just click on the link and everything then should go ahead normally. Okay, thanks for watching.